Welcome, Jaime Rodriguez. We are so excited that you are going to be speaking with us at the State of Therapy Conference on September 26th at Clark University. And your topic is fascinating. The state of mental health, how therapists are shaping the future of mental health and care through advocacy. Can you tell us a little bit about what was your inspiration for this topic?
Yes, so it has bloomed as my professional and personal lives have bloomed through my role as the advocacy chair on the Connecticut Association for Marriage and Family Therapy. Kind of always had a little bit of an interest in politics and advocacy and all of that policy in general. So when I took on this role as the advocacy chair and really got the opportunity to put our systemic mindset and approaches to work in a different setting, it just felt like a completely natural extension to me. Obviously, policy, politics, government is just another system, right? And a lot of the same techniques and strategies and interventions and mindsets completely apply. Um, and it has kind of snowballed from there. So in this work, I often get asked by therapists, well, I'm just a therapist. Like, what do I know about advocacy? Or what skills do I have to do anything that has anything to do with policy reform or legislation? And my answer always is the same. You have all the skills you need right in your pocket. We are naturally advocates. We are advocates for our clients and in front of us. We are advocates within the family systems that we work with them. We are advocates for them in the other systems that impact their lives, whether those be, social services systems or school systems, whatever. So we are naturally advocates. And I personally think that mental health therapists and MFT specifically are the best people to be consulting on policy matters that impact our mental health community. We know the ins and outs. We know the trickle down effects and the ripples that these policies and how they impact not only providers, but also, our clients and our patients in the communities. So I think our voice is very important, and I want to continue to share that with other people.
Wonderful. Yeah, I've always felt that urge to advocate more on a systemic level.
Yes.
Um, can you describe what do you think there's a particular urgency right now for our community to be thinking about advocating?
Absolutely. As the state of the world has changed and the state of our country has changed in many different ways, um, I don't think that there can ever be too many voices advocating for um, all of our vulnerable populations. We also know that the majority of people seeking mental health treatment also have that crossover identification with being a member of a vulnerable community, right? For various reasons. And I don't have to explain that to mental health therapists. I'm sure they get that. So I feel like there can never be too many voices advocating for that. And given the pushback that we're getting from the state of our world, the state of our country, about these vulnerable populations, about the validity of basic human rights to these people, absolutely, we need to be standing up, and it has become even more urgent for us to be a member of that chorus, but also to lead with a systemic mindset, and our therapeutic trainings of being able to have these conversations in productive ways and not increasing conflict, but increasing conflict resolution, increasing communication, increasing empathy, compassion, understanding in those conversations.
Yeah. Now you are from Connecticut, so
Correct.
you've been doing all your advocacy on behalf of clinicians in Connecticut. Um, how do you, can you talk a little bit about what you've accomplished there and what you think Massachusetts needs to be getting on board with?
Yeah, absolutely. So in Connecticut, we we are lucky in a lot of ways. That we are a very progressively minded state, and a lot of our laws and policies attempt to reflect that. But that does not mean that obviously things are perfect and there's not work to be done. So, the kind of the work that I've done has encompass many things, even from all of us as mental health providers coming together to work to expand and make permanent our telehealth options for mental health therapy. That was a huge piece that we worked on together. And again, that was another example of us thinking systemically and going to all of the other mental health licenses in our state and state associations and saying, this is something we're unified on, and we need to present as such, and had humongous success with that. But then there's everything else, and I'm not trying to be quantitative in any way, but I feel like there are so many other small pieces behind the scenes that people don't see,
Mhm.
and that still make an impact and still matter. Like, for example, last year we were working on something in Connecticut, around a universal intake form for children in the mental health system. And there were a lot of voices that had a lot of opinions on that. And I think, again, thinking systemically um, in my public testimony for that, I really discussed the importance of having all of those voices at the table in developing that, and not just one licensure type or just one person kind of writing what should be in that, right? We should not
Yeah.
only have all the different license types, but we should also have um, adults now that were former children patients in the mental health system weighing in, and what would have been helpful for them. And we should also have children's advocates and mental health patient advocates, and we should have everybody kind of weighing in on that. And out of that conversation, and I'm not saying that it was all me, but in bringing that conversation in the public hearing, a work group was developed, right? That has all of these pieces included in it. Another piece that we worked on in Connecticut this year was our license portability for MFTs. So this is part of the national initiative that you may be aware of, um, to expand license portability across state lines and open up access to care and increase the workforce, all of those things. And Connecticut did in fact pass this past session. And this is something, in my mind, that strengthens our profession, strengthens our communities of MFTs, strengthens our professions, strengthens access to care. And I think that is also something that other states in our New England community, right, because we are a small community in that way, could all benefit from.
Yeah, absolutely. It's a pretty hot topic among LMFTs and other licensures in Massachusetts for sure. Everybody's talking
Absolutely.
about it. So we really hope to benefit from your experience. What do you hope that the participants in your workshop walk away with? What sort of skill or strategy or inspiration are you hoping for?
I'm really hoping that they walk away feeling empowered, and that their expertise, their life and professional experience matters, and that they can go back to their own community, whether that's their own state, whether that's their own agency they work in, whether that's their own neighborhood, their own school district, whatever that looks like for them, and say, I have something to add, and I want to be impactful on whether it's legislation, whether it's social reform, whether it's whatever that matters to them. I have the skills to do that, and the confidence to do that as well. That's what I'm really hoping, that we continue to expand our systemic impact in our communities outside of the therapy room.
Amazing, Jamie. It's such an important topic. I'm so glad you're going to be presenting and sharing your wisdom with Massachusetts.
Thank you. I'm so excited to come.